These are the diseases from A to Z. You should know about them for your own safety. Asthma's a disease that affects your lungs. Has anybody seen my inhaler? Botulism is a rare but serious paralytic illness caused by a nerve toxin that is produced by the bacterium Clostridium botulinum. The German physician and poet Justinus Kerner first developed the idea of possible therapeutic use of botulinum toxin, which he called sausage poison. Now, home-canned vegetables are the most common cause of foodborne botulism outbreaks in the United States, but honey can contain the bacteria that causes infant botulism, so children younger than 12 months old should not be fed honey. Chlamydia is the most commonly reported STD. Dementia's a decline in mental ability. Elephantiasis causes swelling and disfiguring. Fungal meningitis is no fun if you've got weakened immunity. With gonorrhea, yeah, it burns when you pee. Human immunodeficiency virus, aka HIV. Influenza's just a longer name for what we call the flu. Japanese encephalitis causes inflammation of the brain, oh yes it's true. And Kawasaki disease is a febrile illness in kids under 5. Listeriosis is typically foodborne and food is where it thrives. Monkeypox is a rare disease that is caused by infection with monkeypox virus. Of course! The first human case of monkeypox was recorded in 1970 in the Democratic Republic of Congo. The natural reservoir of monkeypox remains unknown, but probably African rodent species are expected to play a role in transmission. Now, monkeypox virus occurs when a person comes into contact with the virus from an animal, human, or materials contaminated with the virus. So you avoid those things if you can! Norovirus is highly contagious. Stomach, intestines inflamed. Ow. That must hurt. Osteoarthritis, the degenerative joint disease. Pneumonia infects the lungs and can vary in severity. Q fever is caused by bacteria Coxiella burnetii, and it's found worldwide and naturally affects animals such as goats, sheep, and cattle found in birth products. People can get infected by breathing in dust that's been contaminated with animal feces, urine, milk, and birth products, and then they'll have flu-like symptoms. It's difficult to diagnose, but your provider can perform blood tests, and most people will recover without antibiotics, or those that require treatment can have the antibiotic doxycycline. So, no vaccines available, so avoid contact with animals, especially during birth, yours and their own. Oh, also, don't consume non-pasteurized milk and milk products, please. Rabies is viral. It can affect our pets and us. Shingles is herpes zoster, the risk increases as you age. Tuberculosis can be latent but can spread up in the air. Ulcerative colitis and inflammation of the GI tract. Belly fever can be from fungal spores. Avoid dust when you backpack. Whooping cough or pertussis is highly contagious. Xenotropic murine leukemia virus was first identified in 2006 in prostate cancer patients. Yellow fever virus is found in tropical and subtropical areas in South America and Africa. The virus is transmitted to people by the bites of an infected mosquito. We have no specific medicines to treat yellow fever virus, but definitely avoid aspirin or non-steroidal anti-inflammatory drugs, which may increase the risk for bleeding. Yellow fever is preventable with a safe, effective vaccine. So get it if you need it. Zika spread through mosquitoes and sex. So get a condom and get yourself a mosquito net.